So ovarian cancer is still that cancer with the highest mortality rate among gynecological cancers. Here in the US, about 14,000 women die each year of that disease. So there is an unmet need to help to better treat these patients. In the past decades, we have succeeded to improve first-line treatment with surgery and chemotherapy. And nowadays, about 80% of patients are free of tumor after their primary therapy. That sounds good, but again, 70 to 80% of these patients recur. So relapse is the major problem. So we have to invent therapies that maintain this success. So that was the reason for doing a maintenance trial to evaluate therapies which could maintain this success. Yeah, the results of our trial was that Pazopanib gained an almost 6 months benefit of progression-free survival. So it delays recurrence, it delays need of secondary chemotherapies, and it prolongs the time where the patient gets control over disease instead of disease getting control over the patient. We have no meaningful analysis of overall survival currently. We have an observation period of 2 years, and fortunately, only 20% of patients have died. So at the moment, there is no direction in either way for this drug. But we hope that we can translate that. Currently at 24 months, where we have reliable data, there's no coming together of the curves. So we hope that there will be translation into overall survival, but we cannot say that at the moment. Yeah, the toxicity we observed in this trial is class-specific, and it's a typical toxicity we know from this drug, which is also already registered in renal and cancer and in sarcoma. So it's hypertension mainly, some diarrhea, some neutropenia. Our overall conclusion is that we have another trial which supports that anti-VEGF treatment directed against angiogenesis is very effective in ovarian cancer. And we have now a drug available which can be used orally during maintenance and which offers a significant benefit for the patients. And it works even in patients where there's no residual tumor, so just prolonging recurrence. This is a significant and valuable gain for the patients. Yes, I would say so. So this study helps to register the drugs, and hopefully the registrational agencies will register and label that drug. And then I'm sure it will be used in daily practice. They should closely follow up the process. So the filing is done currently, so maybe in 6 months we have more information whether this drug is registered for ovarian cancer, and then this should be discussed with the patients.